Feeling stressed, overwhelmed? It's time to unstress your life and focus on controlling what you can control. I'm Dr Ron Ehrlich, host of the Unstress Health podcast, inviting you to join the Unstress Health community and discover a holistic approach that helps you more effectively face the daily challenges of our modern world and effectively recover each and every day. Unstress Health is here to provide you with advice and support that is independent of industry and influence, an influence that's easy to miss but difficult to ignore. Our focus is on building mental fitness. Your mind can be your best friend or your worst enemy. Mental fitness is the key. Our three-phase approach targets mindset, boost your positive intelligence quotient, and move from self-sabotage to self-mastery. Secondly, the challenges. We redefine what stress means in our modern world. And thirdly, recovery. Master the 5 pillars of health. As a member of the Unstress Health community, you'll turn obstacles into opportunities with expert-led courses, curated podcasts, personalised health assessments, a supportive community, and much, much more. Join Unstress Health today, and together, let's not just survive, but thrive. Click on the link below or visit unstresshealth.com. Well, today we explore low-carb diet, insulin, diabetes, and as you will learn, diabetes is a huge and growing problem. Type 2, there are two or now maybe 3 types of diabetes. Type 1 is where the pancreas does not produce insulin. Type 2 is insulin resistance. Now, 85 to 90% of diabetes cases are type 2 diabetes. It used to be referred to as late onset diabetes because it occurred later in life, but it is now affecting children as well. So it is type 2 diabetes. And more recently, type 3 diabetes has been thought to be a way of looking at dementia. And we've explored that with Patrick Holford in our Food for the Brain conversation. But today we are exploring insulin and diabetes. And one of the greatest breakthroughs, I believe, in public health in over 40 years. My guest is, and I'm welcoming back, in fact, Dr. Peter Brukner. Now, Peter is a legend. He is a world-renowned sports medicine clinician and researcher. He was formerly the Chief Medical Officer for the Australian men's cricket team and has also held similar roles at the Liverpool Football Club in the English Premier League, also with Australian rules Football League clubs Melbourne and Collingwood, the Australian national football soccer team, the Socceroos, and was the Chief Medical Officer for the Australian Olympic team in Sydney 2000. So Peter comes very well credentialed. He's world renowned. But actually he's wearing another hat, which is that he is the founder of Defeat Diabetes, which is based on a low-carb, healthy fat diet. And as you will hear, a recent collaboration in Australia has been really what I believe to be one of the most significant breakthroughs in public health in over 40 years. An initiative which is addressing the cause of disease in a cheap, achievable, sustainable, and most importantly, effective way. And why this isn't being rolled out to every Australian, let alone the 2 million Australians that suffer from type 2 diabetes, is a mystery which we will explore and have explored on this podcast before. But I hope you enjoy this conversation I had with Dr. Peter Brukner. Welcome to the show, Peter.
Lovely to be here, Ron.
Well, I should say welcome back, because it's been always good to catch up with you and get the latest on what's going on. And what is going on is really something incredibly exciting. And I mentioned it in the intro of Defeat Diabetes, but I wondered if you might give us a brief recap of the history of Defeat Diabetes.
Yeah, sure, Ron. I mean, I guess, I'd been interested in the diet thing for the last 10 years or so, and particularly the low carb. And I guess, type 2 diabetes is really the elephant in the room in many ways. I believe that it's the biggest single health issue in the country, in the Western world anyway. And there is ample evidence now that the low carb eating approach is highly effective in the management of type 2 diabetes, putting it into remission or reversal or whatever you want to call it. We can talk about that later. And there are programs in both the UK and the US that have proven to be very effective. And I guess I was sort of waiting for someone to do something in Australia along similar lines, and waiting, and eventually I realised, well, it ain't going to happen unless I do something about it. So I got together with Paul Mason, who you would know, and a fellow. Paul and I have similar backgrounds, and we started in sports medicine, and we've sort of moved into nutrition, and a dietitian called Nicole Moore, and that was our COVID project. We decided we'd put together a program which we called Defeat Diabetes, which consists of a whole bunch of videos, articles, recipes, meal plans, cooking demos, etc., that could tackle the issue of type 2 diabetes and basically give people the knowledge and the means, if you like, to tackle it. Because I think it's really important to have some understanding of what the disease is and why low carb works and how it works and so on. But also then very practical things, what do I eat? What do I eat when I'm out? And, what takeaway food can I have? And all this sort of stuff. So we put together a sort of a series of lessons, as we call them, which each consists of, one video and a bunch of articles and things and so on. And and we've also got a sort of very active Facebook group of our members, so which is, really quite stimulating. So we started that, when did we start that? 3 years ago. And we launched it. It's a subscription model. So people subscribe for 3 or 12 months. It costs virtually nothing. I think I worked out it was about a cappuccino a fortnight it costs. We launched that, and we've had over 10,000 people go through the program or subscribe to the program, and lots of good feedback and so on. We've done a couple of surveys of our subscribers and to how effective it is, and they've both been very positive. With between 50 and 60% of people putting their diabetes into their sugars into the non-diabetic range, shall we say. And weight loss and reduced waist circumference and so on. But being realistic, they're just surveys. I mean, so what we decided was that we needed to do some rigorous research, independent research. So we went to the nutrition department at La Trobe University here in Melbourne, and Professor George Mishonis was happy to undertake that research. We have a PhD student called Despina Kolovas, and we designed a research project involving GPs. So we contacted GPs through the College of General Practice, and we invited them to sign up for this research project. And I thought we'd get about 50 GPs, but we got about 150 GPs. And what we asked them to do was identify patients in their practice, or a patient or patients in their practice with type 2 diabetes, doesn't matter whether it was newly diagnosed or been there for ages, who were interested in a low-carb eating approach, and introduce them to the Defeat Diabetes program and monitor their bloods for the 12 months. So do bloods at 0, 3, 6, and 12 months. And we recruited 100 people into that program, and we have the 3-month data, and we've got most of the 6 and 12-month data, but we've got all of our 3-month data. And in fact, our PhD student is presenting that data at the Australian Diabetes Congress in Perth next week. And again, it shows that about 85% of the subjects improve their glycemic control, so improve their blood sugar levels. More than half, about 55%, actually reduce their HbA1c, which is the measure we use for diagnosing diabetes, into the non-diabetic range. So they all started off with an HbA1c of over 6.5, which is the diagnostic criteria, and more than half of them after 3 months were under 6.5. And so in theory, were not diabetic anymore. But a number had reduced their medications. We didn't have anyone in the program on insulin. We had a number who were on the oral different drugs. So that's pretty exciting. The weight loss was significant, the waist circumference. And interestingly, we also looked at a bunch of sort of quality of life sort of measures. And there's an interesting one called diabetes distress, which is a validated quality of life. And that markedly reduced on the program because people, you sort of, as doctors, maybe we don't appreciate it enough, but people, when they're diagnosed with type 2 diabetes, it's very stressful. And, they read about all the complications and so on. Anyway, so that measure was decreased. So we're pretty excited about that research. We're submitting it for publication, and hopefully that'll come out in the next little while. This, as I said, our 3-month data, and then we're going to have 6-month and 12-month data. So it's sort of it's very similar, almost identical results to the UK, the diabetes.co.uk papers, and the Verta Health studies in the States. Very similar, somewhere between 50 and 60% of patients, no longer in the diabetic range. So, which is, as we know, Ron, as we were taught in medical school, it's a chronic progressive disease. There's nothing you can do for it.
Well, Peter, I think it's fair to say that the doctors who parrot that, and they're only really repeating what they've been taught and continue to be taught, truly believe that until often they themselves are confronted with the diagnosis, and then suddenly curiosity kicks in a little bit more and goes a little bit further back into their medical education, back to biochemistry and physiology, and go, hang on, maybe I can do something about this. That's not an uncommon story, is it?
No, absolutely. I mean, the most passionate advocates of low carb eating among the medical profession are those who've had experience themselves, who've been diabetic or pre-diabetic. I was pre-diabetic, and turned it around with diet. And there's nothing like your personal experience. I mean, you can read all the articles and the textbooks and the videos and the YouTube and so on. But if you go through it yourself, I mean, that's a very, very meaningful experience, and that's what happened to me. It's how got me started, and that was 12 years ago, and I'm still going. Yeah.
And you're looking very well for it too, Peter. You also said something that you felt that diabetes was the most serious disease, and we've done programs on cancer, on cardiovascular, on autoimmune, on mental health, and the common denominator in all of them is not just chronic inflammation, but elevated insulin level is such an underlying cause of so many other conditions. So what you're saying is absolutely right.
Absolutely, it amazes me that more people are not concerned about type 2 diabetes. And I've got a theory, Ron. The theory is that the problem with it is that people don't die of type 2 diabetes. Okay, so they die of the complications of type 2 diabetes. So we've got to remember that type 2 diabetes is the most common cause of blindness. It's the most common cause of amputations. Most common cause of kidney disease, of kidney transplants or dialysis. It's very closely associated with cardiovascular disease. I mean, there are eminent cardiologists who say everyone who has a heart attack is an undiagnosed diabetic. I'm sure you've heard that saying before. Mental health, massive issue. There are really exciting areas now in the treatment of mental health with low carb. Dementia, Alzheimer's. And Alzheimer's is called type 3 diabetes. So. And and even cancer. There seems to be some strong links with cancer now. So all these are diseases that kill us, but the underlying cause is type 2 diabetes. And as you say, the root cause of that is insulin resistance, and you know, we should be tackling that as the number one health priority in the country. And yet, you know, people just throw a few drugs at it, and you know, don't really care. And we have there's so much evidence now that a dietary approach can make a massive difference in to type 2 diabetes, and yet, you know, nobody's interested. There's no money in diet. That's the trouble, Ron.
Well, it's a common theme and it's a common expression I have on this program that good health may make sense, but it doesn't make dollars. And it's actually why, Peter, on a little bit of diversion here, why I really believe workplace well-being is going to be where we're going to see this change, because there is a confluence of interests there.
Yep.
But listen, the one thing that I also struck me as you were talking was you have 10,000 members of Defeat Diabetes. How many people in Australia suffer from type 2 diabetes?
We think it's close to 2 million. So
2 million.
Yeah, we're just scratching the surface, as you say. My aim was to get 100,000 people onto our program, and you know, we would, you know, I mean, our experience, that would mean that, you know, more than half of them would no longer be, you know, in the diabetic range, and all the others, you know, significantly decrease their sugar levels. I mean, you know, we might have someone who starts at 10 and goes to 7. Well, they're not non-diabetic, but gee, you know, their risk of complications for every 1% HbA1c is reduced. You know, it's something like 30% less amputations and kidney and all that sort of stuff. So
Wow.
massive improvements, and so simple, cheap, easy, you know, and yet, you know, we spend hundreds of millions of dollars on drugs, and, you know, trying to find drugs for Alzheimer's and you know, all these different things. Whereas we've got a very simple solution that's cheap and has been proven to be effective. The problem is that no one wants to know about it because there's no money in it.
Well, we're going to talk about, because you know, you've taken this on, Peter, and I think because of your high profile, people have actually sat up and taken notice, and there's some very exciting things happening which we want to talk about. But I still want to talk about this low carb approach, because a few months ago we had the pleasure, the privilege, the honor of talking to Michael Mosley, who tragically died shortly after that interview, I might add. But he had been championing for many, many years the low calorie approach, the fast 800, as he talked about it. And as I was talking to him, and I've obviously been very connected with low carb for many years, like yourself, I was listening to him and I thought, gee, you know what? I can really get why Michael had become so famous and so popular, because he was still talking about the calories in, calories out story that had been a public health message for so long. And, you know, I guess the question is low calorie versus low carb. I mean, somebody might be saying, look, I'm going to go low fat and low carb, and I'm going to tick both boxes, so I'm going to be doubly good. What do you say to somebody who focuses on low calorie? What's the shortcoming there? And, you know, well, what do you go? What do you say to that?
Yeah, look, I think, you know, let's look at what is effective. So there are 3 things that are effective, leaving aside, you know, the latest fancy drugs and so on, which we can talk about later. But there are 3 ways of drastically reducing your body fat levels, you know, your obesity, and or improving your diabetes control, putting your diabetes into remission. The first is bariatric surgery. Effective, yep, absolutely. But, you know, not everyone wants to have half their stomach chopped out, and
not without not without complications going forward.
A lot of side effects, very difficult to live with, but effective. You know, absolutely. You know, research shows and clinical experience shows effective. So that's number 1. Number 2 is what you mentioned, the low calorie approach. You know, you put someone on an 800 calorie a day diet and they will lose weight and they will improve their diabetes control. Absolutely. But they will, they'll be hungry and angry. You know, It is just, I defy anyone to stay on an 800 calorie a day diet long-term, you know, and most of the effective research shows that, you know, you've got to use shakes and soups and so on rather than proper food, you know. So, most people will go onto a low-calorie diet, will last a week, a month, 3 months maybe. They're miserable. It's really difficult because they're hungry, and then they relapse. And that's where you get this yo-yo dieting. People go on it, off it, on it, off it. They're not happy. It's not an effective long-term weight and diabetes control. And the third way is the low-carb approach. And the reason that's effective is that you're not hungry. You can eat as much fat and protein as you like, and so you don't have that issue with hunger. So that's why I would say that the low-carb approach is really the only practical, effective way of those three methods. The other interesting issue is that, if you're on a low-calorie approach, 800 calorie a day, I mean, that's low-carb. That's got to be, really, because you're not eating anything, really. So in a way, you're eating low-carb with hunger, whereas a low-carb approach, you're eating low-carb without hunger. And so that's why I think, it's interesting, Ron. I'm sure you have this as well. People say, but low carb's not sustainable and so on. It's interesting. The only people who say that are people who haven't tried it.
Yes.
Anyone who's done it knows that you feel so bloody good, and you lose weight, your fatty liver disappears, your diabetes control improves, your brain fog disappears, your sleep, all these sort of factors. And that's very motivating, and you keep going. Because once you go off it for a weekend and you feel like rubbish, and you get back on it on a Monday morning and say, right, I'm back into it. But so I think it's cheap, it's effective, and it's sustainable. And it's sort of logical. Because, what is type 2 diabetes? It's a disease of carbohydrate intolerance. So, as my kids would say, duh, you don't give them carbohydrates. It's not rocket science.
Yes.
And yet somehow that logical fact escapes the medical profession because we're so distracted by drugs and surgery and so on that we lose our sort of common sense and logic, and we stop thinking. And I was guilty, absolutely. Put my hand up. I was guilty for 30 years of my medical career of following all the dogma and just, doing whatever they said. And then, at some stage, you sort of wake up and think, hang on a minute, that doesn't make any sense at all.
Yeah.
The recommended diet for a type 2 diabetic is high complex carbohydrates. How crazy is that?
Yeah, I know. Look, Defeat Diabetes was celebrating it. Not Defeat Diabetes. Diabetes Australia was celebrating its 75th anniversary, and I went onto the site. In fact, I wrote about it in my book, the 10 steps for living life. The key word being here with diabetes. And step number 1 was include carbohydrates in every meal and eat low fat. That was step number 1 of a 10-step program, and I realised the key word here was with. If you wanted to live life with diabetes, you would follow that advice. But if you wanted to live life without diabetes, but Peter, there's another group that I think, you mentioned those 3 groups. I know from a friend of mine who has been fanatically low fat. He wants to do everything right because Ancel Keys in the 50s and 60s and doctors have been parroting it ever since. Low fat is important. Avoid saturated fats. So when he went on to a low carb diet, he wanted to tick both boxes. He wanted to be doubly good. He wanted to be low fat and low carb because there is, you mentioned it, but I think we need to highlight it. There is an issue about fats as well in this process, isn't it?
Yeah. Well, look, the whole fat thing is, it's a fascinating story. The way we became obsessed. You mentioned Ancel Keys. And some very dodgy research back in the post-war era that has since been disproven. But people just remember the research. And he did some studies, a 6 countries and 7 country study that he pointed out there was a direct correlation between the amount of fat in the diet and the incidence of heart disease. But then it turns out that it wasn't a 6 country study at all. It was a 22 country study. And when you put the 22 country study in there was no correlation at all. But he'd plucked out the 6 that gave a nice little sort of straight line. So, basically the whole fat thing is based on a fraud. And, even Ancel Keys said that dietary cholesterol has no effect on your cholesterol. Look, it's it's an incredible saga. I mean, and the books written by Gary Torbs and Nina Teicholz are documented in a fascinating way. I mean, that's what initially got me interested in this reading those books, and I couldn't believe how we fell for this obsession with saturated fat. And there's now there's over 20 systematic reviews, which is the highest level of evidence that shows there is no correlation between saturated fat and cardiovascular disease. And yet you talk to any doctor, any dietitian who will try and convince you that saturated fat is the worst thing in the world. And yet, it's actually the polyunsaturated fats, the omega-6s, the seed oils, the vegetable oils, that are the issue. And, again, there were two big research projects that showed very clearly that saturated fat was preferable, but they were both buried. And it took, it was only years later that someone reviewed so there's a lot of corruption and a lot of dishonesty that goes on in medical research, unfortunately. And I go back to it again, a lot of it's driven by money. And, there is a lot of money in cholesterol and high cholesterol and the evils of saturated fat. There is not a lot of money in eating in a low carb diet. And,
No.
As I always say, follow the money. And it's just frustrating, Rod.
There is another aspect to it as well, and that is if I as a doctor have been giving this advice all my professional career, it takes a bit of humility. And I don't want to cast aspersions here, but doctors' egos are not always the smallest of egos out there in society. There's not that humility, although, dealing with chronic disease is a humbling experience, particularly if it continues.
Yeah.
But this is now listen, but there is this great collaboration, Peter, and I congratulate you and Zoe Eaton, the CEO, and Paul Mason, Defeat Diabetes team. This is, I believe, the most exciting public health initiative in 40 or 50 years. Share it with us. Tell us what happened.
Well, it was interesting. When I first started with Defeat Diabetes, I thought I should, talk to Diabetes Australia. They were the peak body and so on. So I had a coffee with the CEO, and it's fair to say that meeting did not go well. If we put it politely, say we agreed to differ. Yeah, I didn't get anywhere. They were, he was an ex-pharmacist, very wedded to the sort of pharmaceutical, to the carbohydrate line. So I sort of, thought, oh well, give up on Diabetes Australia. A couple of years ago, they changed their CEO and brought in a new CEO, Justine Kane, and which I think I'd heard about, but I didn't sort of again take too much notice. Anyway, out of the blue, she contacted me and said, "Look, I'm in Melbourne next week. Let's catch up. Let's have breakfast." I thought, "Oh, okay, all right." So rocked up to breakfast at a hotel in Melbourne. She ordered bacon and eggs, and I thought, well, that's a good start. And the first thing she said was, what can we do to help you? Anyway, when I picked myself up off the floor, we had a really great discussion, and she was very aware that that Diabetes Australia had been dragging their feet on the whole diet thing, and was keen to sort of offer their members access to a low carbohydrate approach. And I said, look, that's great, but you've got to get this past your doctors and your specialists and so on. They're never going to agree to that. And she sort of said, well, leave that to me. She said, I've got support from a number of people. Anyway, so and the one interesting thing that she said a number of interesting things, but one of the interesting things she said was the thing we get asked about most at Diabetes Australia is diet, and we have nothing to offer. And so, I said, well, I can fix that. So, I mean, she was at pains to say, look, we are never going to say that everyone should be, on a low carb diet or the defeat diet. And I said, no, absolutely. And you're quite right. Everyone's different and there's no one diet for everyone and so on. But what she did want to do was offer an option. offer an alternative that if people wanted to go down that path, and there would be a process by which they could do that. Anyway, so we started chatting, and I thought, oh, this is gonna happen. This is great. Anyway, so these organisations, she's terrific, and they've got some great people there, but they're complex organisations. Let's put it that way, with a lot of stakeholders, and it took a long time. Probably took 18 months to go through the process of approvals and so on. And then finally, a few months ago, we announced a partnership between Defeat Diabetes and Diabetes Australia. As I said, it's the first time they've ever endorsed a diet, even though, as I said, they're careful not to say it's for everyone. And that's been I think that's, as you mentioned, that's a real breakthrough. It's an acknowledgement by the peak diabetes body that a low carb approach is a valid approach. Now the next step is to get them to convince that it's the best approach, but at least it's a valid approach. And we presented a lot of scientific evidence, which, as you know, there is lots. And they were happy to. And I finished up. I had to meet with the diabetes specialists, the endocrinologists, and the Australian Diabetes Society, and so on. And they were all comfortable with what we were doing. So it's interesting. I mean, we announced that a few months ago, and we've had a bit of an uptick in subscriptions. But more importantly, I think we've just been contacted by a lot of different organisations and. The health funds, the primary healthcare networks, businesses, different organisations. And what it's done, I guess, is given us sort of a bit of a seal of approval, a bit of to our program. And that's opened a lot of doors for us, and we're really excited about that. We've managed to get some, philanthropic funding in as a result. And so I think it's a first step and an important step. And very exciting. So, but there's still a long way to go. We've got a long way to go to convince. There's three groups, really, professional groups that we need to win over. One is the doctors, GPs, and specialists, diabetes specialists. And interestingly, we are running the first course for GPs in October. A one-day course in Sydney for GPs through the College of General Practice. Be a fully approved, accredited. There'll be more details coming out about that in the next few weeks. The second group is the diabetes educators, who are part of Diabetes Australia, but sort of have some independence. And while they're not really supposed to be talking about diet, they obviously do, and they're still very much wedded to the traditional carbohydrate approach. And the third group is the dietitians, who've really been the ones who've pushed the low fat, high carbohydrate line for forever, really.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below, or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Who also, Peter, I would venture to say, they wrote the Australian Healthy Eating Guidelines in 2013. And if anybody bothered to look at the website at the time, they were sponsored by the Grains and Legumes Council, by Campbell's Soup, by Nestle, by the list goes on and on. So the dietitians of Australia have, I believe, quite a lot to answer for. But sorry, I shouldn't have
No, they
interrupted.
do. I agree. I think it's changing. Particularly the younger dietitians now are much more aware. They're all a bit scared to to pop their head above the above the parapet sort of thing. But there's a lot more interest in from younger dietitians.
Mm,
Unfortunately, they're not the leaders of the profession yet, and they're not the professors at university and so on. But even there's gradual change. And
hmm.
interestingly, James Mukey's group, the Australian Medical
Yes.
Health Practitioners, Metabolic Health Practitioners, are running a course on low carb eating for dietitians, similar to the course we're doing for
Great.
GPs. So, there is progress. It's slow. It's frustratingly slow. It really, so many times, we hear of patients who do their own research or talk to people who've been through the low carb approach, go to their doctor or their dietitian and say, oh, I'd really like to try this low carb approach, and the doctor says, oh no, you'll drop dead of a heart attack tomorrow, or the dietitian said, no, you need carbs to live, which you don't. So it's a real, it's so frustrating. You're battling against your own profession, and
Mm-hmm.
that shouldn't be.
Well, I also should have mentioned James Mookie, of course, former Australian of the Year, who we've had on the program several times, and together with yourself, such high-profile people championing this is a real hope. But you mentioned professions, your profession, and it's interesting because we also recently did an interview with Dr. Laureen Laylor-Smith, which was just an amazingly inspiring,
Wonderful woman. Yeah.
wonderful woman, and a wonderful story because this dovetails into another theme of this podcast, and that is workplace well-being, and specifically doctors' well-being. And here was Laureen with fatty liver disease, overweight, high blood pressure, obstructive sleep apnea, burnout in the practice, which Tabitha Healy informed us 44% of doctors suffer from burnout, characterised by the acronym DIE, disengaged, ineffective and exhausted. And after 35 years of practice and burnt out, she's approached low carb, turned her entire life around, including her husband, who's a GP with Parkinson's, and now loves medical practice and is just got so much to offer the public for the next, hopefully, 10, 20 years of her life. What a story. I mean, I think there's a story here about let's improve doctors' health, and that will roll on to public health. Great to hear you talk about running this program.
Yeah, look, I think it's really important. I think most GPs, I mean, being a GP is by far the toughest job in medicine. Don't let any other
Yep.
fancy, highly paid specialist tell you otherwise. General practice is bloody tough, and you're seeing lots of patients. You don't have enough time. And most GPs I talk to, particularly those who've been doing it for some time, are really struggling. As I said, they don't have enough time with their patients. They don't feel as though they're helping their patients enough. You talk to people like Lorraine, and David Unwin in the UK was another classic example of someone who was ready to retire. He said he'd stopped enjoying medicine. He didn't feel as though he was doing much for his patients. He was writing out scripts, and that was it. And then all of a sudden, he had an experience with low carb and changed his whole practice. It changed his own life, but changed his enjoyment of medicine. All of a sudden, he was actually able to help people and get results and so on, rather than just Band-Aid stuff. I mean, I think the reason most of us do medicine is we actually want to help people. I know that sounds very altruistic and all that sort of stuff, but
I think it's absolutely right.
I think we do, and obviously it's intellectually challenging and all those sorts of things. But I think underlying it, that's what we're trying to do. But unfortunately, for many doctors in their practices, if they're realistic about it, they're probably not doing a lot to help their patients. They're just adding more and more medications to them, and they add a medication to counteract the side effect of the previous medication, and so on. And here is something with this low carb approach that really is exciting, and you can see results, and it makes a massive difference to people's practice, and GPs I talk to, are so excited. They've been in practice 30 or 40 years, and it was, I was talking to a doctor recently, and he was just basically semi-retired. He sort of said, "Oh, I just wish I'd known this 30 years ago. I would have, done so much more good for my patients and so on." So it's never too late. But yeah, I think doctors' health. Most doctors are on the traditional, low-fat, high-carbohydrate diet. Many of them are overweight. Many have type 2 diabetes, the same as the rest of the population. You'd think, doctors should be immune to that sort of stuff, but they're not. And a lot of autoimmune disease, a lot of issues. So there's the personal aspect, and then there's also just the enjoyment of the job, and it's so rewarding. Every now and then, I must admit, probably like you, Ron, I get frustrated and I feel as though I'm bashing my head against a brick wall, and to try and make an impact and so on. And then then I get a text or an email or something, message pops up on Facebook saying I've put my diabetes into remission. I've lost 8 kilograms, so I feel fantastic. I just want to say thank you.
Yes.
And you think, oh, yeah, okay, I'll keep going.
When was the last time you prescribed an antidepressant and got that kind of response from somebody, or anything for that matter? But yeah, look, it's
the mental health is really interesting right now, and I'm sure you've had people on the program talking about mental health and so on. But there's more and more evidence coming out that mental health is significantly impacted by diet. This whole metabolic psychiatry, they call it. And, there's a couple of great books out by Chris Palmer and Georgia Reed. And there's a number of, I'm told there's a dozen large research studies going on around the world looking at the impact of diet, and particular low-carb diet on different mental health issues. I mean, I had an interesting experience. I had a lady come up to me in the coffee queue at university one day, and she said, Dr. Brukner, and I said, yeah. And she said, I enjoyed your lecture the other day. I said, oh, that's good. And she said, but that's not what I want to talk to you about. And I thought, oh, God, what have I done? What I say in this lecture? And, who have I upset this time? And she said, my husband and I are massive cricket fans, and because of you, we changed our diet to a low-carb diet. And my husband's been bipolar all his life, and he's now off all his medication, and I just want to say thank you. You've changed our lives.
Wow.
Oh, wow. And more, stories like this about bipolar disease, schizophrenia, depression, anxiety. It's so exciting. I mean, I think, because as you say, antidepressants, I mean, they're not that effective. And here's a simple means of having a massive impact on these these issues that you mentioned Parkinson's before. There's some really exciting evidence about Parkinson's, about Alzheimer's. No drug works for Alzheimer's. We've shown that. There's been billions and billions of dollars spent trying to develop a drug, and yet there's some good studies showing that diet is effective. But again, no money.
Well, that's so interesting you should mention that, because we have recently done a program with Patrick Holford, and another amazing public health initiative is Food for the Brain, which I'm very, very proud to be associated with as well. And and we've also done a program with Professor Julia Ruckledge in New Zealand, who's written a wonderful book about food and the brain. But listen, you also, look, your background in sports medicine is legendary. You've been associated with the elite teams in the world, and particularly the Australian Olympic team for many years. And you've just come back from Paris 2024, and Australia has done amazingly well. I mean, a country of 25 million coming fourth, I think we came.
Yeah, remarkable. Yeah.
Tell us about it. What was your impression?
Well, look, it was a wonderful Olympics. I mean, Paris, is a great city, but they did a fantastic job. I mean, the iconic venues, the Eiffel Tower, the Grand Palais. I mean, all these different things. I better just get rid of this phone call. It's James Mukey ringing me. I better ring him.
Tell James you're on the podcast. His episode came out last week.
That's right. So Paris was fantastic, and they really did a good job of designing the venues around the the city, and there was a great atmosphere around. Interestingly, there weren't as many people as usual in Paris. All the Parisians leave town for August because it's hot and so on. I think they all left a bit early because they escaped the Olympics, but I'm sure they regret it now because it was such a buzz. And the events it was well run. The crowds were terrific. The atmosphere was great. It was easy to get around. The transport system in Paris is just fantastic. I don't think we waited longer than 2 or 3 minutes for a metro all week. All fortnight. It was great. So yeah, the real winner was Paris. I thought. I've been to a lot of Olympics now, and I always thought that Sydney 2000 and London 2012 were the best too. But gee, I reckon Paris has given them a good run for their money. And then obviously, Australia doing well was terrific. We always do well in swimming, but lots of other. I went to one of Jess Fox's gold medals in the canoe slalom. It was such an exciting spectator event, and athletics is my main passion. I went to every night of the athletics, and we did better than ever there for Australia. So it was it was fantastic too. And my younger son lives in Paris, so I had the spare room in their apartment, so that was saved a bit of money on accommodation. But it was lovely to spend time with them, and they have a little 10-month-old baby, so we had 2 tickets every night. So 2 of us would go to the athletics or the swimming or whatever, and one of us would stay home and babysit. So it was very nice.
Fantastic. Why do we do so well? What do you think it is about Australia that makes us do so well? We punch so far above our weight.
Yeah, look, I think there's a number of different reasons. One is that sport is big in Australia. Sport's an integral part of society in Australia, probably more so than in most other countries. I think we I always sort of say that I knew when there was a sign that I'd grown up when I started reading the front page before the back page, but I still haven't happened. So I'm still sort of there. We've got to have a quick look at the front page. There's a really big sports story to be on the front page. But it's interesting. I heard a great saying once that sport, the back page is all about people's triumphs, and the front page is all about people's disasters and so on.
Right, interesting.
That's quite good. But so I think sport is a big part of, and obviously our climate helps, and we're in a reasonably wealthy country and so on. So we have good facilities and things. So I think that's a factor. I think government support has been very good. The Australian Institute of Sport, 30 or 40 years ago was set up, and the different state institutes and governments. I think there's a lot of argument about elite funding of elite sport compared to funding of community sport, and I think they're both very important, and I think doing well at Olympics certainly inspires younger people to get out and play sport, and which is such an important. Not everyone's going to be an Olympian, but everyone is going to benefit from playing sport, and so I think sport is a really important part of our culture. I think also in the sports science and sports medicine world, obviously I'm biased there, but I think Australia's always led the way in many sort of innovations and so on. So we're right at the forefront of that. I think, and we're passionate. We're passionate about our sport, and it's very exciting to see us do so well. And I enjoy rubbing it into my, especially my British colleagues who finished below us in the medal tally, despite spending a huge amount of money and having 3 times our population. But I don't rub it in too much.
But listen, there was one aspect there of diet that we did hear the story of, and that was the sort of promotion is happening so much out there in the media of this plant-based diet. And I can't help but wonder whether this environmental story is an excuse for promoting ultra-processed food. Plant-based will be to the 21st century what processed food was to the 20th century.
Oh, that's very cynical of you, Ron.
What did you think? The athletes must have been very upset.
Yeah, absolutely. Athletes are not stupid. They and as you said, it's all part of this. There was a big emphasis on environment. They had cardboard beds and paper mattresses and all this sort of stuff, and so on. And one of the myths around the environment is that plant-based eating is better for the environment than meat eating.
Yep.
And as you know and I know, that's a load of nonsense. The best way for the environment is responsible agriculture, and it's actually very, and people sort of suddenly, think that the reason the environment's, going down the tube is because cows are farting or belching or something. I mean, cows have been farting and belching for a long time, and nothing's changed there, and so on. So, but it's a very convenient, as you say, very convenient thing to blame food and animal-based food as the cause of the environment, and there's absolutely no evidence to support that. But it's the common belief, and it's been encouraged by, as you say, by big business, by big food. There's a lot of money in processed and ultra processed foods, and most plant-based foods, that are quite highly processed, and you've got to look at this fake meat and this fake this and fake that, which has been a disaster. Basically, they haven't done well, these companies. So give credit to people; they actually are not totally stupid. Yeah, so the athletes arced up, because the issue with athletes and with all people really is that protein is a really important part of our diet, and it's for muscle building and for muscle maintenance and body structure and so on. And plant protein is just not as effective as animal protein. I mean, we know that. No one argues that. You can, if you put together particular mixtures of plant protein, you can get a little bit of protein, but it's just not as effective as animal protein. And the vast majority of athletes take in a lot of animal protein, and with very good effect. Now, there's always going to be the odd plant-based athlete, and if, as I said, if they're really careful and so on, they can get a reasonable amount of protein, but it's far better to get it from animal protein. So they arrived at the village, and there was very little animal product there, and particularly very little meat. And I think you're allowed 2 little chops or something like that, and that was about it. If you're a sort of a 150 kilogram weightlifter or something, that's not going to be very satisfactory. So there were so many complaints, they had to ship in a whole lot of meat, and I think by the time of the second week and so on, things had improved. But it was a reminder that there are forces out there that unnecessarily concern with your health, and they have ulterior motives. And I think blaming the global warming or our environmental issues on cows is just it's disgraceful, really, and it's detrimental to people's health. And the best form of protein is it comes from animals, and because it's interesting, because the plant-based people, or the vegans as we used to call them, they sort of lost the argument about health. So now they've sort of jumped on the environment argument to try and justify, and really, when you look into the science of that, there is no evidence for that. So it is very frustrating, because it's obviously there's a lot of money in this, and there are a lot of people out there who are really pushing hard to get everyone eating these highly processed plant-based foods, and it's not helpful for our health or our environment, really. Because it requires a lot of energy to produce those things. So, yeah, that they quickly shut that down in the village in Paris, and things improved. But it's not a bad place to eat. It's interesting. I mean, because there's this thing called the French paradox that you've probably heard of. That we identify French food as being very unhealthy, as we think it's all those croissants and baguettes and pastries and so on. And yet the French have the lowest incidence of cardiovascular disease in Europe. And people, when people don't understand something, they call it the paradox. They say, "Oh, it's the French paradox." That's weird. We don't understand it. But the reality is that they eat a lot of butter, which is very healthy. Their croissants are full of butter and so on. Their baguettes are very different to our white bread here. Your baguette you got to eat on the day that you get it, or else it goes off. Whereas our white bread here, it's so full of preservatives. You can keep it for 2 weeks and you can still eat it. So they use a different flour, they use a different techniques and so on. So I lost a couple of kilograms when I was in Paris, despite having a croissant every morning and an occasional baguette and so on, which is more than I would have back home. But when in Rome or when in Paris, as you do what they do, and I finished up losing weight, which was interesting. So, but it's a joy, to the one thing they don't do that well is coffee. We're spoiled in this country. We have the best coffee in the world, and you think France, coffee that just Italy's nearby, and you'd have decent coffee, but no. Anyway, but first world problems, as they say, Ron.
First world problem. Well, Peter, listen, you talk about forces working against health and the powerful forces, but geez, it's such a pleasure and a privilege to have you on the program as a force that's really making a difference in our country. And I want to thank you for joining us today, and thank you for absolutely everything you are doing and have done. Thank you so much.
Oh, it's been a pleasure, Ron. Always a pleasure.
It is really a sad reflection on the medical profession, I have to say. I mean, it is one thing to make the observation that the medical profession over the last 40 or 50 years has unwittingly, and I say unwittingly because they really have the best intentions, there is no question about that, but they have unwittingly presided over the worst epidemic in preventable chronic diseases in human history. And this diabetes story is showcasing the very worst of modern medicine and the ridiculous state that we have come to in our healthcare system. When something as simple, as cheap, as sustainable, as effective as a low-carb, healthy diet is not embraced by the medical profession, is a sad reflection on that profession. It is mind-numbing. When you go to see your doctor, do not ask them the question, what do you think about a low-carb diet? Ask them the question why they do not embrace something that is clearly so effective. And I don't think I can state that any plainer or in any other way. Why do they not? Because we've done programs with James Mookie, former Australian of the Year, with Dr. Loreen Laylor-Smith, an incredible story of a doctor turning around their own health and in the process changing the way they had practiced medicine for 35 years, where they had reached a point of burnout. And now, after 35 or 38 years of practice, have set up a clinic with low-carb, healthy fat, ketogenic diet, and are turning people's health around and receiving feedback from their patients, which is so rewarding, so empowering, so wonderful that they go to work every day and cannot wait to go to work. Now, I'm not sure there are all that many doctors practicing allopathic or prescription medicine that could say the same thing. So we will have links to Defeat Diabetes. Incredible that it only has 10,000 members, but this is about early adopters, and the tidal wave of response will no doubt follow. And I congratulate, as I've said, Peter Brukner, James Mookie, Loreen Laylor-Smith, Zoe Eaton, CEO of Defeat Diabetes, Paul Mason, who I would love to get on the podcast. Paul, if you're listening to this, Paul is just brilliant. You should see his YouTube clips, Dr. Paul Mason. They get hundreds of thousands of views for a very good reason. This is an exciting initiative. And I would also add that Food for the Brain, which has been founded by Patrick Holford, who we did a program on just a few weeks ago, is another of those most exciting public health initiatives. We are going to turn public health around. Sadly, I don't think it's going to come from above. It is going to come from initiatives from people like Peter Brukner and Patrick Holford, and I hope that this podcast is a small part of that. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness, from self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.